People are getting addicted to all kinds of digital products. People are getting addicted even to things like the news that you wouldn't think are addictive. I've had people reach out to me about literally being addicted to reading. Of course, in my book, I do talk about my own addiction to romance novels, but I've heard it now from other people who talk about their quite serious addictions to reading. Almost anything that's sort of reinforcing has the potential to become a sort of maladaptive habit loop.
Hi everyone, welcome to Reason with Science. I'm your host Jitendra. This is a conversation with Dr. Anna Lembke. She is a chief of the Stanford Addiction Medical Dual Diagnosis Clinic at Stanford University School of Medicine. Dr. Lembke is a psychiatrist expert in treating addictions of all kinds: drugs, alcohol, food, sex, video games, gambling, medication, etc. She is also an author of the book Dopamine Nation, Finding Balance in the Age of Indulgence. In this conversation, we talk about what is addiction, how to detect addiction, role of dopamine in addiction, pleasure-pain balance, tools to avoid and conquer addictions, and societal role to fight addictions. This podcast is important for not only who is fighting addiction, their family and friends, but also people who want to have an aware and healthy lifestyle. Share and subscribe to the podcast. Thank you for listening. Hi, Anna. Welcome to the podcast.
Hi, thank you for inviting me.
Yeah, so let's start with a textbook question. What is addiction? That's one thing. But also we can extend that question to a more philosophical question. Why do we want to get rid of it?
Okay, interesting. So addiction is the continued compulsive use of a substance or behavior despite harm to self and or others. In terms of how we diagnose it, we have a checklist of behaviors and symptoms that we use to diagnose addiction. So the subtext there is that there's no blood test or brain scan to diagnose addiction. We base it on behaviors, patterns of behaviors. And that checklist can be summarized by the 4 C's: out of control use, compulsive use, craving, and continued use despite consequences, plus 2 physiologic symptoms: tolerance, needing more and more of a drug to get the same effect, or finding that the drug stops working over time, and withdrawal, meaning that we have a physiologic response to decreasing the dose or stopping. So that's the kind of summarized checklist of how we diagnose addiction. And addiction is a spectrum disorder from mild to moderate to severe. It's not like everybody is the same in terms of their addiction, or even in terms of their vulnerability to addiction.
Yeah, and the philosophical question. So why do we want to get rid of it?
Well, I guess to me, I don't know that, I love philosophical questions, but to me, it's just sort of a very practical question. Why would we do things that are harmful to ourselves and or others? And addiction certainly is. It may not begin that way, but it almost always progresses to the point where we're hurting ourselves, we're hurting the people we care about, we're potentially killing ourselves, potentially causing accidents that kill other people. So it's just not good.
Yeah. So in general, when we talk about addiction, people think that it's substance addiction, but I think the major form of addiction is these habits, right? Which is simply going for a certain thing again and again. It can be a substance, but it can be certain habits or activities that we do, right?
Yeah, so substance is sort of the generic term that we use for anything we ingest or put into our bodies, a chemical that is addictive. But you're absolutely right. We have what we call behavioral addictions or process addictions. And those are addictions to things like pornography, gambling, shopping, video games, social media. Food is an interesting one because typically we don't put food under sort of substances because we need food to live. On the other hand, it's not entirely a behavioral addiction because we're clearly ingesting something. So food has this interesting in between, but certainly people can get addicted to sugar. They can get addicted to processed food. There's lots and lots of processed food now. So.
Yeah, and I think the interesting thing to highlight here is the fact that, so because what is addictive in these substances, right? If we talk about any opioid-based substances, we can talk about that. But then, as you also mentioned, it's also food that we eat, right? So it's, I think, only the habits. So it means like making these neural circuits to go over things again and again.
Yeah. So, I mean, you're making a good point, which is sort of looking at it at a very meta level. Isn't it just these compulsive neural loops? But, people would argue, well, what about obsessive compulsive disorder, right? Those are these compulsive neural loops. We have an intrusive thought that tells us that, we're dirty. The compulsion is to wash our hands. So how is that different or the same as an addiction? I think that is a very good question. And I don't exactly have the answer to that because it does seem to have sort of similar types of behaviors, except that generally with OCD, it starts with a negative thing, which is this intrusive thought. And then we do the behavior to relieve it. Whereas usually, when we think about addiction, we think about approach behavior that initially starts because it either gives pleasure or relieves pain. So the first part of the cycle is that it brings some kind of relief. But it could be that we're just entering the same neural loop at a different place.
Yeah, and are all of us prone to addiction to the same extent?
No, we have different degrees of vulnerability to addiction. Some people are much more vulnerable than others. And it's important to keep in mind that we have different drugs of choice. So what may be reinforcing and potentially addictive for you is not for me, right? So that's another very interesting piece of it, that people are attracted to different types of rewards.
Yeah, and is there any correlation between age and sort of addiction, that at certain age people are more prone to addiction than maybe later or before?
Yeah, great question. So traditionally we think of adolescence as a time of sort of experimentation, and that's really true. And so typically, if the old thinking was, if somebody was going to get addicted, you would usually see some sort of signs or signals of that in the teenage years. Now we're kind of changing our thinking around that because we're seeing more and more people get addicted in middle and older age who weren't actually addicted when they were younger. This might be a function of us living longer. And so people who can sort of use in moderation, maybe as they age, are less able to do that. But certainly in general, we do think of adolescence and young adulthood as sort of the peak time to get addicted. If you look at epidemiologically, the largest numbers of people or prevalence for addiction is in that 18 to 25 age group, and then it tends to fall out. And we do have data showing that the earlier that people use a substance, the more likely they are to get addicted to it. This idea that it is important to protect the young brain from these types of patterns.
Yeah, actually, so of course, you've written a book, Dopamine, amazing book. There's a lot of information, and having this sort of big outline, of course, to understand addiction, but also prevention. But one thing that I sort of wanted your comment on is the role of parenting itself in those years, right?
Yeah. Mm-hmm.
So if you say that in these age years, like children or maybe people are more prone to the addiction, so how does the role of or what is the importance of role of parenting in this case?
We have pretty good data on this, showing that if parents have a good and healthy attachment to their kids, and also know where their kids are and what they're doing, even to the extent of like knowing what's in their backpacks or in their rooms. Those kids are relatively protected from developing addiction later in life. On the other hand, if there's a complicated or unhealthy attachment with parents, if there's some kind of physical, emotional or sexual abuse, if the parent is just kind of checked out and doesn't know where the kid is and what they're doing or what's in their backpack or what's in their rooms, those tend to be situations where kids are more likely to be at risk for addiction. Also, if parents themselves are addicted and use substances and sort of condone substance use as a recreational activity or as a way of coping, then those kids are also more likely to use substances and to get addicted to substances.
Yeah, the other interesting thing was in general, its availability, right? If it is much more accessible, it's simply, I think people can get more addicted. What's your comment on that?
Yeah. So, just simple access to drugs is a huge risk factor for addiction. And it's one that we really often don't think about. But if you live, in a neighborhood where drugs are readily available on the street corner, you're more likely to try them. You're more likely to get addicted. If you go to a doctor who freely prescribes opioids for anything, you're more likely to be exposed to opioids, more likely to get addicted to opioids. Likewise, if you live in an environment like we do, where we have these smartphones that 24/7 deliver these digital drugs, we're more likely to try them and more likely to get addicted to them.
So what is the weirdest addiction that you know?
Oh my gosh. Well, I really wouldn't want to call any addiction weird, because that kind of implies, that the people who are addicted are weird. And I would never say that. People are getting addicted to all kinds of digital products. People are getting addicted even to things like the news that you wouldn't think are addictive. I've had people reach out to me about literally being addicted to reading. Of course, in my book, I do talk about my own addiction to romance novels, but I've heard it now from other people who talk about their quite serious addictions to reading. So, almost anything that's sort of reinforcing has the potential to become a sort of maladaptive habit loop.
Yeah, and when we are talking about the loop, I think we tend to enter in this loop because of this notion of find your passion. What's your understanding about this?
Yeah, so I think this is sort of one of these cultural memes now, this idea that if we could just find our passion in life, we would be happy. But I think what that can sometimes lead to is just these very high expectations that people have about, what they should be doing with their lives, plus a lot of FOMO, fear of missing out, like, oh no, my passion might be over there, but I'm over here. And instead, I think that there's some kind of false promise in that idea, and a lot of potential disappointment that people will feel if they feel like they haven't found their passion. Where instead, I think a better way to think about it is, wow, this is kind of the life that I've been given. These are the people, this is the people that I've been slotted with. Let me try to infuse my passion into the life that I've been given, rather than continually looking for, it over somewhere else.
Yeah, let's talk about the major actor in the addiction movie, which is dopamine. Yeah. So first of all, of course, what's dopamine, and how basically it relates to addiction?
So dopamine is a chemical that we make in our brain. It's very important to the experience of reward, motivation, and pleasure. It's also important to movement. And it's no coincidence that those things are linked. When we do something that's pleasurable or reinforcing, we get the release of dopamine in a part of our brain called the reward pathway, which is a very old part of the brain. It's been around for millions of years without changing much. It's the same across many different animals, all animals really, even primitive worms. And it's basically what's kept us alive through millions of years of survival in a world of scarcity and ever-present danger. It's what makes us approach pleasurable things and avoid painful things. But what happens when we become addicted is that if we do something repeatedly over and over again that's highly pleasurable and releases a lot of dopamine all at once, then essentially our brains are forced to adapt to that or accommodate that by downregulating dopamine transmission and dopamine production so that we can get into this chronic dopamine deficit state that looks just like depression. And when we get into that state, we're essentially in addicted brain. Now we're using just to feel good. It doesn't really work anymore to get us high or to solve the problem we were hoping to solve. And when we're not using, we're in this subthreshold state of withdrawal, which is usually, characterized by almost irritability, anxiety, insomnia, depression, and craving. So we can get into this sort of vicious loop where then we feel we need our substance, to get out of this state of pain and withdrawal and psychological distress. But every time we use, we're really just contributing to that dopamine deficit state.
Here we can also talk about, in general, how much sort of we have modified our environments. So if we think of our ancestors living in, in wild plains, basically how dopamine would help in those scenarios. I mean, especially for, looking for food or mate or even to make social bonds. And the fact that now we have modified our environments where we have food available all the time, and then of course the other sort of facilities.
Yeah, exactly. I mean, we now live in this dopamine overloaded world where we can have pretty much anything we want at the touch of our fingertips anytime we want it. And of course, this is a huge mismatch with our primitive wiring, right? Our wiring was really meant for a world of scarcity, which is why, every time we do something pleasurable, there's a come down afterwards. And the reason Mother Nature made that come down is to motivate us to keep looking for the next thing. But if we live in a world of abundance like we do today, then what happens when we have the come down is just with one tap of the finger, we can get more, right? And so that drives us further and further to this new hedonic set point or pleasure pain set point, where now we need more and more pleasure to feel any pleasure at all. And we feel pain when we're not feeling pleasure, right? And any even the merest slight can kind of give us pain. And so that's where I think we are now, where we're seeing at the individual and collective level, more and more people with depression and anxiety, addiction, suicide. And I hypothesize in the book that the reason for that is because of this overabundance that we're not really evolved for.
Yeah, so here the interesting point is that we of course, we can't go back, right? We do have all the resources around us, and one way or the other way, most likely we'll be using maybe not everything, but maybe 50% of it or certain percentage of it, right? So the point being, if now, we have all these different resources and we are utilizing them, which maybe we can call them distractions if we are not looking at the right thing. So what is the correlation between, sort of using these different sources and addiction? Well,
I mean, could you ask that again? Sorry.
Yeah. So the question is that the fact that we are using all the different sources, it can be even on internet, it can be using different apps or using internet. Or simply using using other activities, okay, at the same time. So what is the correlation of that with with this pleasure pain balance?
Right. So, I mean, quantity and frequency really matter when it comes to addiction. And what's happening now is that we're all constantly bombarding our reward pathway with these little, dopamine hits, large and small, throughout the day. And the result is that we're all more likely to get into that place where we are experiencing the addicted brain, because we're not leaving any time in between for that balance to reset itself, for homeostasis to reoccur, for our own dopamine to upregulate. We're constantly, blah, 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 this and that. And so the result is really that we're kind of walking around in this dopamine deficit state to try to compensate.
Yeah, but also the fact that we are working in this reward-based system, right? Where you work more, for example, most of us researchers, I mean, or, the other people who are continuing with their careers, they work more and they get more. This is sort of a common phrase, right?
Yeah. Oh, so your point is sort of like it sort of then creates the culture of what we're all striving for.
Exactly.
Yeah. Yeah. No, that's right. I mean, I think part of it, I think what you're getting, maybe you're getting at the whole workaholism piece where it's not just drugs, or it's not just watching, YouTube videos. It's the whole striving culture where achievement itself. I mean, we can kind of get addicted to work. We can get addicted to achievement, always striving for that next recognition. And then when we get it, kind of feeling like the letdown of like, that wasn't really what I thought it would be, which is disappointing in and of itself, but then might then strive, lead to more striving, more money, more awards, whatever it is.
Yeah. So what do you strive for in your career further?
Well, I'm just trying to keep my head above water. I really don't. I don't have, first of all, I would say, in my career, it was when I really stopped striving for external accomplishments that I started having more of an impact, which was really paradoxical, right? But when I really let go of that sort of ego-oriented attainment and just sort of thought, well, where can I be of use, or where can I do good? Then mysteriously, my ability to leverage my position to do good seemed to expand. But it was very interesting to, experience that it was when I really stopped trying to sort of achieve that I was able to, in fact, achieve more.
Yeah, but then what is the motivation? How do you get motivated?
Oh, yeah. Well, to me, it's to be of service, right? To try to help other people. And I really enjoy one-on-one patient care. That has always been the thing that I've loved, and continues 25, 30 years later to be the thing that gives me a great deal of satisfaction and joy, just having an impact, on individual patients and their families. It's a fabulous honor to be able to, be involved in people's lives at their most vulnerable, and also, at a very intimate level, right? We're not talking about superficial things here. We're talking about the stuff that really matters to people.
Yeah, I could sense that from the stories that you mentioned in the book itself. And of course, from there, I had this question, what is the relation of addiction with the people that they don't have, or they don't get that sense of belonging to the society, to the family, or to their, to the people who are living close to them?
Yeah. So, I think, addiction is really a highly antisocial disease, because I think what happens is the drug itself comes to replace all of the things that we need and get from other people in our lives. Sometimes people talk about the lack of human attachments as the cause of addiction. And I think that can be true, but I've also treated many people who have wonderful people in their lives and very, good relationships, and still become addicted and then turn away from those relationships. So addiction is very, very pernicious and wily in that regard. Even when your life is good and you have a lot of good people, you can get addicted to something and then basically replace those relationships with this drug, which then becomes your friend and your lover and your everything.
Yeah. So for the solution of the addiction problem, one thing that you talk about is the dopamine fasting. Yeah. So what do you think, how it can help? So, and is it similar when it comes to substance addiction, like taking certain drugs, or and we compare it to certain habits?
Yeah, well, I basically got the idea for the dopamine fasting, which is 30 days of not using your drug of choice, from treating patients with addiction to drugs and alcohol. Because a lot of my patients with addiction to drugs and alcohol would come in with depression, with anxiety, and without doing anything else, not prescribing any pills or doing any psychotherapy, if they would stop smoking or stop drinking, typically a month later, the majority of them would say, hey, my depression is better. Hey, I'm less anxious. I'm sleeping better. So I was really able to see over many years that the substances alone really cause these symptoms of depression, anxiety, insomnia, and just stopping them can make people a lot better. Not everybody. Some people will stop their drug of choice and still have terrible, psychiatric symptoms, but that's useful information. Okay, that person needs some other intervention. And then I started seeing more and more people with behavioral addictions to sex, to video games, to shopping. And so I started recommending the same kind of thing. Well, hey, could you stop for 30 days? Let's see what it does. And lo and behold, they felt a lot better too, which really has led me to believe that these kinds of behaviors are drugs, that they work on the reward pathway in the same way that drugs and alcohol do, and that the intervention is pretty similar.
Yeah. What is the sort of percentage? Is there any data that how many of the patients they sort of end up leaving their drug and choosing that sober life?
Yeah, we have pretty good data on that. And if you look across different studies and different types of interventions, there's about a 50% response rate for people who actively engage in treatment, which is pretty good. I mean, it's pretty similar to the response rates we see when we treat things like depression and other sort of chronic illnesses like obesity, even chronic medical illnesses. The response rates and the relapse rates look pretty similar as the treatment for addiction. So I think that's important because a lot of people think, well, there's no treatment, and once people get addicted, that's it. But really, there are millions of people all over the world living in recovery from addiction, doing great. So it's really a myth that people don't get better.
Yeah, and the other thing that I was thinking, and simply like to have these kind of conversations, to write about the issue here, and I think giving people that sort of firewall already, that they don't end up in this vicious loop, as you mentioned, and that's really good. And one of the tools that you also mentioned in your book is the mindfulness. So how effective mindfulness is when it comes to leaving addiction?
Well, when you're trying to recover from an addiction, mindfulness is not really optional. You end up doing it, whether or not you want to, because what happens is when we no longer have our drug of choice to reach for, to kind of chase away those uncomfortable thoughts and emotions, we have to learn to sit with them. And that's essentially what mindfulness is. It means observing your thoughts and emotions without judgment, and also without trying to escape or avoid them. So mindfulness is, of necessity, what you have to learn to do if you're going to stop using your drug of choice, whether it's a behavior like pornography or a drug like cannabis. And, it's a very useful practice because we kind of get to know ourselves. And when we get to know ourselves, that's generally a good thing because then we get better at sort of articulating our experiences, expressing our emotions, saying what we want and what we need, accomplishing our goals.
Yeah, the other thing is that simply when certain behavior or hobbies, they become addictive, So like, for example, in my case, I like good badminton match. I may like, read good books. go for some photography, etc. Right? And these things I can do over and over. So in my case, I need this like multiple activities for me to keep myself engaged. But then at which point I can, or someone can understand that this is becoming more addictive.
Right. So, I mean, I think, first of all, most of the things you named are things that require effort. So it's not just passively sitting back, taking a drug. I mean, to go out and do photography, or did you say play tennis? Was that the other one?
Yeah, badminton.
Badminton, right. I mean, those are things that require your effort. You can't just sit on the couch and press a button and play badminton. Probably soon you'll be able to, but not yet. And so anything that you have to put effort in, it's a great way to get your dopamine in directly, and so much less prone to addiction. Although people can still get addicted to those behaviors, addiction to exercise, addiction to really, any activity. Again, the things to look for, it's not like there's a certain amount of time or a certain frequency. It's not about that, although it's related to time, frequency, and quantity. But it's about, the nature of your relationship with that behavior, and whether or not you're compulsive about it, meaning that even when you don't want to do it, you find yourself doing it. Whether or not you can stick to the limits that you set for yourself, or is it out of control? Whether or not there are consequences, like people who get addicted to exercise will end up with, major injuries, and then they'll keep doing the activity until they've really hurt themselves. Those are all the kinds of signs and symptoms to worry about.
Yeah. So, what are the other sort of ways that help in this withdrawal phase when we are trying to get rid of certain addiction or bad habit? Mindfulness is one. Probably, as you said, to participate in more engaging activities. That's second. What else people can do and try?
So in that early recovery time, abstinence, not doing our drug, you have to practice mindfulness. Yes, finding other activities, especially effortful activities or even painful activities. So I sort of suggest to my patients that they sort of invite friction into their lives and intentionally do things that are hard as a better way to get dopamine indirectly. And it's very counterintuitive, because typically in early recovery, we feel bad, right? And we think, well, okay, I can't smoke pot, but I'm going to have a cookie, or I'm going to watch a Netflix movie. But actually, that's not the right thing to do. Instead, you want to go for a walk, or you want to do something creative and effortful that requires you to focus your mind, because those are things that again, provide a more enduring source of dopamine and are less vulnerable to the problems of tolerance and neuroadaptation. The other thing I really prescribe to people is truth telling, what I call radical truth telling, which is where you commit to telling the truth about everything, not just about your drug use, but also about other things like why you're late for the meeting. Because telling the truth really forces our frontal lobe to activate, and our frontal lobe is really important to modulating, our reward pathway.
Yeah, and how about sort of replacing one kind of addiction to the other kind of addiction, which may not, or which you may think that it's sort of less harmful in a way?
Yeah. So in general, like I said, it doesn't really work to replace like one drug with another drug. Why not? Because all that does is just continue to sort of bombard the reward pathway with these high dopamine substances and behaviors. Instead, what you want to do is you want to do things, again, that are effortful, that are not immediately reinforcing in the moment, but that make you feel better after you're done. If you do something that's just immediately reinforcing, like, oh, I'm not going to smoke pot, but I'm going to watch Netflix, the problem is that you're liable to become addicted to that other thing, right? So that what we call cross addiction. And we see this all the time as people try to get into recovery, that they try to switch out one drug for another, and then they just end up getting addicted to that second drug.
And how about the sort of dopamine blocking drugs, if they are helpful in that phase?
Yeah, so there's a lot of new exciting pharmacology, medications that we can use to try to modulate this pleasure response. One of them, for example, is a drug that blocks our opioid receptor. And it's used to treat opioid addiction, which makes sense because if you're blocking the opioid receptor and you take heroin, the heroin won't have any effect. But it's also used to treat things like alcohol addiction, because when we drink alcohol, it stimulates not just dopamine, but also our own endogenous opioid system. And so if we have naltrexone on board, if we drink alcohol, or that's the opioid receptor blocker, if we drink alcohol, it's not as reinforcing. And if it's not as reinforcing, then we're less likely to overdo it.
And the other question that I had was this, the idea of psychedelics to use or to treat certain, I don't know, especially the addiction, right?
Yeah.
So,
well, I'm very skeptical about psychedelics to treat addiction. And I'll tell you why. Addiction is a chronic, relapsing, and remitting illness, and it usually requires a chronic type of intervention. So it's very unlikely that, sort of a single intervention, even if it goes over the course of a year, is going to make the difference. I think what's really happening with psychedelic-assisted psychotherapy is that the psychedelic is enhancing the therapeutic bond between the patient and the therapist. And then the therapy itself is what's actually providing, the healing. But I worry that in using a drug to enhance the psychotherapy, we're sending the message to people that they should be reaching for drugs to augment that human attachment. One of the main things that we have to, try to teach people who get addicted to drugs is that they can actually make those intimate connections without using drugs, right? Because a lot of people, once they become addicted, they're like, well, I don't think I can have sex unless I'm drunk, right? Or I don't think I could even go out and meet people unless I take X, Y, or Z drug. And so recovery really is about people realizing that they can develop those intimate human attachments without the substance, right? And so that's why I'm not a big fan.
Yeah, and this question is especially for the people who sort of practicing this new method. It's not new, at least the science of it is new, called Hormesis, where we can talk about intermittent fasting, cold showers. So basically, taking this pain in small amounts for better health. So what is the power of Hormesis for addiction?
Well, remember, what happens in addiction is that you basically reset your pleasure threshold so that you need more and more dopamine to feel any pleasure at all. And when you're not using, you're kind of depressed. So with Hormesis, the idea is that you're now doing the opposite. You're intentionally engaging in uncomfortable or even painful activities, not in too high doses, in modest doses. And what you're doing when you do that is you're signaling to the body, oh, I'm experiencing an injury. So the body needs to protect us by upregulating our feel-good hormones like dopamine, like serotonin, like norepinephrine, like our endogenous cannabinoid and endogenous opioid systems. And the data show that's exactly what happens. So for example, when we immerse ourselves in ice cold water, that leads to a gradual and steady increase in dopamine levels that remain elevated for hours afterwards before coming back down to baseline. Now, contrast that with when we smoke pot or drink alcohol or watch pornography, where we get a sudden spike in dopamine, followed by plummeting levels, not just to baseline, but actually below baseline before returning to normal. In other words, we pay that price of that dopamine deficit state. And with noxious stimuli or painful stimuli, we don't have to pay that price. We pay the price up front because it's painful, but then we get this elevated dopamine for hours afterwards. So it's a really good way to reset your pleasure threshold to the side of pleasure.
Yeah, and the fact that doing this can really help to maintain this pain pleasure balance in the body. It's amazing. Yeah. So the other thing is that, so now at the end, when we are thinking about this pain pleasure balance, we are talking about this abstinence, right? Like to maintain, as you said, dopamine fasting. So at the end, again, the major question is that we can't really leave everything, right? So how to sort of deal with this busy daily life where we are occupied with different activities, and also make sure that we are maintaining this balance of dopamine levels.
Yeah, so it's a great question. Sort of what happens after the fast is over, right? So you do your 30-day dopamine fast. You eliminate that thing that you have that kind of addictive relationship with. The first 2 weeks are terrible because you're in withdrawal. The last 2 weeks are a little bit better. Hopefully by 4 weeks, you've reset your pleasure pathways and you're feeling better, able to enjoy more modest rewards. And then you ask yourself, well, do I want to continue to abstain, or do I want to go back to using in moderation? Most people want to go back to using in moderation. And when it comes to digital devices, we have to figure out how to use in moderation because we need to be on our devices to participate in the modern world. So then it's a matter of developing what I call these self-binding strategies, which is literal and metacognitive barriers between ourselves and our drug of choice. So that's things like using time as a binding strategy, using categories, and using actually geography as a barrier. So for example, I had a patient who was addicted to video games. He abstained for quite a few months, felt a lot better, but ultimately decided he wanted to go back to playing video games. How to do that in a healthy way? Well, he committed to only playing 2 days a week, no more than 2 hours a day. But he also realized he would do well to have a geographic barrier. He would have one laptop for school and a different laptop for games. And that way they were geographically separated. He also categorically did some self-binding. He said, if I play League of Legends, I know I'm lost, so I'm not going to play that game. He said, if I play with strangers, that tends to lead me down the garden path. Better if I only play with friends. So he put all these kind of guardrails in place to kind of keep himself within these limits, and that worked for him.
The other important thing is the boredom in general. So how we can enjoy boredom, that's, I mean, one thing, but the importance of boredom to maintain the dopamine levels.
Yeah, so one of the things that really is true about modern life is that we have a lot more time and a lot more leisure and a lot more disposable income, even among the poorest of the poor. And so we're often left wondering what to do with ourselves. And boredom can be really scary because it can raise all kinds of existential questions like, why am I here and what should I be doing? So we're often trying to run away from that feeling by constantly distracting ourselves with all this stuff in our phones and stuff we eat and you name it. But I think it's really important to learn how to tolerate boredom and really just sit in that place, because boredom is also often the source of creative thinking and new ideas. If we're constantly distracting ourselves and reacting to external stimuli, we don't have the opportunity to follow new thoughts as they surface and really allow them to breathe a little bit. But if we get more comfortable and allow ourselves to sit in silence and without distractions, that jumble of thoughts may ultimately coalesce into some coherent idea or feeling. And I think, again, it's just sort of like settling into ourselves in a way that can feel really good, such that then when we go back out into this modern day world, it seems way too noisy. In some ways, I think COVID-19 sort of did us a favor in this regard. Everybody had to slow down and stay home. And I think it did give people the opportunity to kind of be bored and slow down and not be constantly stimulated, and then reevaluate sort of their lives in good ways.
Yeah, on the other hand, I think there were news, of course, it can be fake news, but maybe you can confirm that post-pandemic, there'll be an increase in psychiatric disorders or something like that. Does it make sense?
Absolutely. I mean, any kind of major social disruption, you're going to see people, suffering with that. So yeah, we saw an increase in drug overdose deaths, possibly an increase in things like, mental health symptoms. Although I will say, I've also heard from a lot of patients and other people that sheltering in place was a time in which they got healthy again.
Yeah. The other thing, or I think this is also an important aspect of getting rid of that addiction, is to make that choice, right? Because at which point a person decide that I want to now quit and just find a solution, right? Yeah. So what's your advice for the people if they want to quit? So when to decide, simply?
Right. I guess what you're asking is what are the factors that make somebody decide they want to change their lives? Is that kind of what you're asking? Yeah, it's a lot of times it's consequences. So, when there are real hard life things that happen as a result of our drug use and behaviors, that can be a big motivator. Sometimes it's something like for a woman getting pregnant, and wanting to take care of this life growing inside her. So it can be a positive big life event or a negative big life event that can make that change. Sometimes it's just, that moment of insight where we suddenly realize the impact that the drug is having on our lives. And one of the ways to realize that is to indeed be honest with other people about how much we're using and how often. When we're just doing that behavior and not telling other people, honestly, what we're doing, we can really be in denial about the behavior itself. But when we admit it to another human being, all of a sudden it becomes real to us in a new way. So that can then, oh my gosh, like I'll have patients, I'll say, well, how much alcohol do you drink? And they'll kind of say, well, how about this week? How about on Monday? How about on Tuesday? And when they go through it at the end, it's like, I say, well, that's 25 drinks in a week. Like, wow, 25, I had no idea I was drinking that much. So it can be this sort of moment of kind of waking up to the behavior that can be really pivotal as well. So, lots of things like that. I think the dopamine fast itself can be a way to realize how addictive we become. I'll have a lot of patients who it's not until they stop using that they're able to, and they go through withdrawal, that they're able to say, or they just feel so much better after a month. They say, wow, that was really impacting my life in a bad way. And I couldn't see it when I was in it.
Yeah, this marshmallow experiment is also, I think, the great example of why or how people can decide. I mean, the fact if we are continuing something for short-term pleasure or the short-term benefits, rather than thinking of those long-term benefits that we can get from the dopamine fasting, etc. Right?
Yeah, exactly right. Which is why sometimes in the clinical setting, what I'll do is I'll ask my patients, hey, do you see yourself using this drug in this way 10 years from now? So really asking them to reflect on the long arc of their lives. And they'll be like, oh, no way. I'm not going to be using like this 10 years from now. I'll say, how about 5 years from now? Oh, no, not 5 years. How about 2 years from now? How about 6 months from now? So that by reflecting on the long, time span, they can say to themselves, well, if I don't want to be using this way 5 years from now, or even 2 years from now, why not look at right now and try to make a change?
So apart from Dopamine, which is your book, what else do you recommend people to read on the topic?
On the topic of addiction, oh my gosh, if you want sort of the basic science-based perspective, The Principles of Addiction Medicine is an excellent textbook on that. And there's lots of great stuff that's been written. There's so many books out there, so many memoirs, great memoirs, great books on addiction. There's a lot of good stuff out there.
Yeah, and of course, since you are not on social media, do you receive a lot of emails with the questions, or you just hear it from your colleagues about if people want to ask questions?
Yeah, so I get quite a few emails. Recently I've gotten many emails, but it's been hard actually for me to respond to them all anymore, even though I really want to. So I've been getting a lot of emails. Yeah. Yeah.
So so at the end, do you plan to go on social media ever, or it's complete
Oh,
abstinence from.
no, I couldn't handle it. I could not handle it. I would be so compulsive about it, and it would make me really unhappy. Yeah. So even when the book came out and like I started to track the rankings on Amazon, I got like compulsive about that. So after about a week of that, I was like, oh no, I can't look at that anymore.
Yeah. And what sort of routine that you follow in your dopamine fasting?
Well, I spend probably 1 to 2 hours a day exercising. So that's really important for me and my sort of dopamine plan. It's not super intense exercise. It's often just a walking meditation. And in the first hour, I have a big jumble of thoughts, and I wish I weren't walking. But by the time I get to the second hour, things settle down, and I find it's very therapeutic and beneficial for me. And then I try to do intermittent fasting with food. I find that's helpful. I do the 8-16 plan, try to eat, in between 8 hours of the day and fast for the other 16. I also try to do intermittent fasting with my devices. So I try to condense my use of screens to my working day, but not use before about 8 or 9 in the morning and not use after about 5 or 6 at night. And then try to take 1 day per week where I have a full 24-hour period where I'm not on any screen at all. That's really tough, but I try to do that.
Amazing. Yeah. Okay, so thank you so much for accepting the invitation and coming onto the podcast and discussing about different topics that you are working on.
Well, thank you so much for having me. Thanks for your great questions, and I enjoyed talking with you.